Dr. Jaffe, can you talk to us about vitamin D and what's the latest update on how to benefit more from vitamin D and how to help avoid risks with vitamin D, please?
Vitamin D is really a neurohormone. It's a neurohormone that regulates cell division. It's a neurohormone that does a lot of things from the cell membrane to the cell nucleus. You need to have enough K2, vitamin K2, along with a basic amount of D3 to start. And then, in our experience, drops under the tongue to bring your vitamin D level. Technically, this is a 25 hydroxy D for those who are technical, but bring your appropriate vitamin D level to 50 to 80. Now, there are actually 3 measures or 4 measures of different aspects of vitamin D. If it's a complicated case, work with someone like Michael Hollick or other super experts in vitamin D, and then you can decide if you need anything more than a basic vitamin D test to keep people in the 50 to 80 range based on drops under the tongue, as well as vitamin K2 and D3. And now you have dozens of benefits as a neurohormone throughout the body, throughout the cells. And it is controversial because there are people who have written up, journalists and other writers, science writers have written up, that it is so common to have a low vitamin D that it is normal. And if it's normal to have a low vitamin D, then don't measure it and don't worry about it. And folks like me take a step back and say, what do you mean by normal? Because you certainly don't mean the common parlance use of the word. Oh, you mean something mathematical and statistical. It's statistically normal for a person to be low or deficient in vitamin D. Now, low is a measurement. Deficient means you don't have enough to benefit. The risk of cancer, heart disease, and other autoimmune complications of chronic and inflammatory repair deficit conditions goes up dramatically if your vitamin D is, say, below 25 or 20, which is very common. And we want you to have a 50 to 80, which provides an ample margin of safety. And if you're a little bit above 80, I'm not worried. But there are people today who, in the category of if this is good enough, then more must be better, are actually recommending much higher doses of vitamin D to raise your level to, say, 150. I'm not in that camp. I don't think the evidence is strong that this is safer and effective-er. But I do know that you substantially reduce risk by keeping your vitamin D in the 50 to 80 range and having enough vitamin K2 to go along with your vitamin D3.